Actually, for kidney patients, we cannot give a recipe like that, because you are not supposed to take juice, or you cannot eat every fruits, right? Even for vegetables also you have choices. In that also you cannot eat as it is, because you know some electrolytes are variant. So we need to leach the vegetables and then only we can eat. So think that all root vegetables you should avoid, like potatoes, but except carrot you can have. Even radish also you can eat. These are the two root vegetables that you can have. Other root vegetables better you avoid, because it contains a lot of carbohydrates. Root vegetables are rich with carbohydrate. So avoid that root vegetables. Always it is better to have green colored vegetables. Okay, green color in the sense Loki you can have. Loki, you know that two varieties of that Loki thing, you right? That two vegetables are very good for kidney patients, that you can even drink it as juice. Not the big glass of juice, small glass. Always minimize the amount of water. When you take any water content, minimize the water content. Again, that you know why. That yesterday we dealt with. We don't want to give a lot of burden to the kidney. So all the water particle kidney has to eliminate. So minimize the quantity of giving water, or eliminatory, whatever eliminatory things has to the kidney, we should reduce it. Whenever you eat something or whenever you drink something, just think about your kidney and then decide the quantity and what you should eat or not. So I cannot give you a recipe as such, but still you can mix any vegetable with celery when you prepare a glass of juice for kidney patients. And mint leaves are also good. Ginger is good. So for taste, you can always add mint, ginger, celery, any of these things with any of the vegetable or the fruit which you are taking. So apple and mint, it's very tasty. So that is one of the drink you can use. That is not only for kidney patients, others can also use. That helps the kidney to eliminate the waste material. So in that, like that, some drinks I prepared. One is ginger, apple and carrot. That is one immunity enhancing drink. Ginger, one small piece of ginger is enough for one apple and one carrot. These are also very good. Then for digestion, easy digestion, cucumber and apple. These are the drinks any patients they can use, especially that helps for the eliminatory works. It helps the kidney to eliminate cucumber and apple. Then every person, they can drink ginger water after their food, after your meal. I mean cooked food. After our cooked food, we can have a glass of ginger water. That is mashed ginger. You can put it in water and boil it and drink. So all the acidity problem, that will go with this ginger water. It helps. See, some of you were taking this pantoprazole medicines before your food. Empty stomach, you are taking pantoprazole and then you are eating your food. Some heart patients, they are taking this particular medicine before each of their meal, because they don't want to get that acidic problem. So instead of this particular medicine, you can take this ginger water or ginger plus honey. Take the ginger juice, mix with honey and you can have it. That will also help. Not for you, okay, honey, you can add it in hot water and have. Not a big amount, maybe 2-3 spoons are enough for you, I mean for kidney patients. And at home, I would like to remind some of the things you can always keep it at your home. I bought a list of it. One is oregano, that you can keep it at home. So that will help to soothe the stomach muscles. So, it is good to have. Another thing is mint. That will be there always at home. Mint and coriander leaves, we keep it at home. Those are the three leaves: mint leaves, coriander leaves and curry leaves. These three things should be at home always. This will help you. Not only for eating purpose, you can use it for inhalation also. Coriander leaves and mint leaves. If your nose is blocked, or if you have some asthma problem. Yesterday we had a patient here. He didn't sleep previous night. The whole night he didn't sleep. Heart patient. Doctors diagnosed as 95% of block. Immediately he should go for a bypass. So they got discharged. So doctors wrote in his medical history that discharged against medical advice. He came here. He had a very difficult heartbeat. So day before he had that breathing problem. The whole night he didn't call us. That was the thing. So yesterday onwards, we gave that inhalation with this mint leaves and coriander leaves and some tulsi leaves. All these inhalation. So yesterday he could sleep very well. So simple things, right? Very simple things. So see how it is replaced a big dose of medicine or something else. Even we have another patient. He's with he diagnosed as 100% of block. I don't know whether you met him. His bystander. These patients got voice rest, complete voice rest. Told him not to talk. Sit only in the room, come out only for sun bath, then go straightly to room, not talking. So their bystanders can talk to you. This patient maybe 1 week is over. So he is also getting better. He is very confident, ready to practice. So 100% in block means you know how serious it is. At any time they may get an attack. It's beyond our control. So they want to try before going to the surgery, the last attempt, whether they can come out without the bypass thing. So in preparation with if any emergency, we have to shift them to the hospital. So his 1 week is over, he is getting better. So we are not doing any magic. They are sitting under the sun, they are eating the same food which you are also eating. So with that food and the sunlight, all the water intake, they are getting healed. So we dealt it with, before classes we talked how the block is getting diluted. When they sit under the sun, what happens to the block? The ghee or oil, if it got stuck in the bottle, what we do? We just keep it outside in the sunlight, or we keep near the fire. It will get diluted, right? The same thing is happening inside also. The block is nothing else, it is the plaque of some cholesterol or whatever. So it need to get dilute and has to eliminate from the body. So when they sit under the sun, this hard thing is getting diluted. Day by day it is getting better. When it is getting diluted, the blood can pass easily. It finds its way to move everywhere. So they feel relaxed from the pain. They feel to run everywhere. They get that energy, no more pain. Otherwise, when they stand or walk, they feel breathlessness because the block is there. Not able to breathe properly, not able to change their position. Because whenever we change our position, the supply of blood has to more in that particular area. When we bend down, the blood has to go like this. When we stand up, it has to come up. So when we are diagnosed with a block, all this work will get disturbed. So that is the reason behind that particular illness.